Next, we'll hear a word from our sponsor, the American Medical Association. Please welcome my colleague, Sarakshi Rai, Director of Audience Development at The Hill. She's joined in conversation by Dr. Bruce Scott, President of the AMA. Sarakshi?
Dr. Scott, thank you so much for joining us today. Please tell us the state of the Medicare physician pay and how it compares to other healthcare providers.
It's actually quite a problem because Medicare pay to physician practices, believe it or not, has actually been cut over 30% since 2001. And as a result, patients are having increasing difficulty getting in to see their doctor. Can you even imagine getting paid 30% less now than you were paid 20 years ago for the same work that you did back then? Physician practices are struggling, and practices like mine are really having financial difficulties. And in some cases, they're actually closing their practices.
And so, how will the latest Medicare physician payment cut, which is the fifth consecutive cut, impact patient access to care?
Undoubtedly, what it's going to do is make it more difficult for patients to get appointments to see their doctors. People don't necessarily think about physician practices as a business, but if you run a business and your revenue goes down every year, 30% in 20 years, at the same time your costs are going up, at some point it's unsustainable. And a recent survey showed that 1 in 5 physicians are actually actively looking to leave practice within the next 2 years. And we already have a physician shortage. Some estimates are as high as an 80,000 physician shortage in the coming year. Now, think about the fact that it takes 8 to 10 years to train a new physician. And yet, there are a lot of practices that cannot sustain even one more year of these cuts. We can't afford to lose even one more doctor. And this crisis is upon us now.
And we already see that, with just the delays with people getting appointments. So, how do these cuts really impact the broader healthcare system beyond just the Medicare beneficiaries?
Well, this affects all patients because you see the private payers, they're well aware of the fact that there's a downward continual spiral of Medicare pay. So as a result, they've tied their payment rates to the Medicare payment rate. And as a result, that magnifies the problem. So this isn't just a problem for Medicare patients. Your doctor, your parents' doctor, heck, even your pediatrician needs you to add your voice to tell Congress that they need to fix Medicare and they need to fix it now.
And so, what do you see for the future of your practice if this issue is not addressed?
Well, frankly, financially, it's become almost a month-by-month situation. In fact, in my own small practice here in Louisville, Kentucky, 2 of our physicians have left at the beginning of this year, and 1 more is looking to leave. And I'm hearing that as I travel across the United States, as more and more physicians are struggling. A close friend of mine who's an obstetrician in a small rural area closed her practice in October because she could no longer financially survive. And frankly, her spouse was tired of supporting her practice with his income. She tearfully sent a letter to all of her patients saying, at this point, I can no longer sustain my practice. She's torn up about the fact that she doesn't know where those patients are going to go to get care. And this is happening. This is not some hypothetical situation. This is real. And as a result, patients are suffering.
And so, beyond canceling that 2.83% cut that went into effect this year, what else can policymakers do to improve the system and safeguard care for their constituents?
Well, maybe the good news is that a group of 10 legislators, bipartisan legislators, this year have introduced a bill. Technically, it's called H.R. 879, the Medicare Patients and Physician Access to Care Act of 2025. What this legislation would do is roll back the cut that went into effect January 1st, and it would also provide a 2% positive update for physicians starting in April. Now, here's a couple challenges. It has to be passed before the end of March. So that's why we really need the patients of America to reach out to their legislators and say that they need to fix Medicare now. We've created a website, which is simply fixmedicarenow.org, which patients can go to, and they can see resources there in order to contact their legislators. And we need to do this now. Part of the other problem is that even Medicare's own prediction is that costs this year are going to go up 3.5%. So even if we get this 2% bump, it's still not enough for physician practices to keep pace with inflation. So ultimately, the American Medical Association is pushing for legislation that would simply tie physicians' expenses and physician payment together. This isn't some radical idea. Hospitals, long-term care facilities, ambulatory surgery centers, and other providers in Medicare already get this inflation-based update. Physicians are the foundation of healthcare. Doesn't it make sense that Medicare should adjust the payment to physicians at least to keep up with inflation so that we can keep our practices open?
All right, Dr. Scott, thank you so much for being today and for your insight. We appreciate it. Thank you.
It's a pleasure to be here and helping to spread this important message.